Dr. David Schiller here, and today we're going to be talking about thyroid autoimmunity and infertility. For many women who are having trouble conceiving, there may be a situation where the thyroid is low. And the most common cause of low thyroid in this country is thyroid autoimmunity, or Hashimoto's. There's a higher prevalence of infertility amongst women who have thyroid autoimmunity, and there could be relationships between the autoimmunity of the thyroid as well as endometriosis and ovarian dysfunction like polycystic ovary syndrome. Polycystic ovary syndrome and endometriosis they have been considered to have autoimmune underpinnings, and as a result, the autoimmunity, because it causes the thyroid to become low, and proper thyroid levels are needed in order to create conception as well as implantation and sustaining of that embryo. If the thyroid is low, you're going to have trouble becoming pregnant. The issue then comes to also with the fertility treatments that they do in a woman who does not have thyroid autoimmunity. When they hyperstimulate the ovary and try to bring in hormones like estrogen, in a non-autoimmune woman, those estrogen treatments are transitory. In other words, they eventually are dealt with by the body and the levels go down again. But in a woman who has autoimmune thyroid, this hyperestrogen treatment that occurs with fertility treatments can actually shut the thyroid off even more. Thyroid reception can be hindered via too much estrogens in the body. Now, the relationship between polycystic ovary syndrome and autoimmunity and thyroid has a lot to do with, sometimes there could be imbalances in your blood sugar that will then cause overproductions of estrogen or shifting in your estrogen productions, which then can also then shut off thyroid reception. So you need proper thyroid function in order to conceive, but with thyroid autoimmunity, you can create a situation where your thyroid reception can be altered. So in order to conceive, you need to find out if you have thyroid autoimmunity. Many women are being told that they have low thyroid, and the thyroid treatment can help with their fertility, but just know if the thyroid malfunction is due to an autoimmunity, just know that you can have autoimmunity against the thyroid, but if there's an autoimmune reactivity going on in the body, you can have autoimmune destruction against the structures and the hormones that will allow you to get pregnant. So it really comes down to not just treating the low thyroid with hormones, but figuring out if you have autoimmunity, and if you do have autoimmunity, figuring out what is driving that inflammation so you can decrease the amount of inflammation in the body, which will decrease the autoimmune reactivity against potential fertility structures. As a result of doing that, then you're going to be better able to conceive and sustain that pregnancy. So there's a lot of research out on this, and just know that if you're trying to get pregnant, that it might be wise to get your thyroid checked. Not only check to see if you have low thyroid, but if you have autoimmune thyroid reactivity, your chances of being infertile or not able to get pregnant are greater. So the women who have thyroid autoimmunity have greater degrees of infertility than women who don't have thyroid autoimmunity. So you can look for our other posts that talk about thyroid autoimmunity called Hashimoto's. If you already know you have low thyroid and you haven't been diagnosed with Hashimoto's, that's something that you can do. It's a simple blood test to do, and if that's the case, then you need also to then figure out what's driving that autoimmune reactivity, what's driving the inflammation in the body, which will decrease your chances of getting pregnant. So I hope this information helps, and make it a great day.